Good morning, everyone. Hi, I'm State Senator Liz Krueger. I have a great panel for us today, and I'm so glad so many of you are already joining us online. As people may know, we do a series of roundtables specifically for older New Yorkers every year, and this is the first one we are doing technically for the year we define as starting post-session. Today's roundtable is about New York's master plan on aging, which many of us probably know nothing about, and yet it's crucially important for all of us in planning for the ability of New Yorkers to age well, to age in place, to be safe and secure, and to have the programs and services that we are more and more likely to all need as we are an aging population. So we just finished the 2024 legislative session, which certainly had a few bumps in the road. This isn't a roundtable on congestion pricing, but people know that just at the end of session, the governor put a pause on something we were working on for 15 years, and we have yet to figure out what we will be doing instead to make sure we have adequate funding for the MTA, including their commitment, which right now doesn't have any money, to work on disability accessibility, particularly to our subway stations that need elevators. If anybody with a inability to walk up and down stairs is going to use them. I'm very proud that I was able to pass important environmental legislation, the Superfund bill, the trees bill to address trying not to destroy the remaining rainforests in the world. We've also worked on legislation to outlaw for-profit hospices, and I'm hoping the governor does sign that because she vetoed it once before, and registration and licensing for mopeds illegally riding on our streets, in our bike lanes, and on our sidewalks. I would like to welcome to our program attendees who are viewing this event on Zoom or Facebook, or who are calling into this first session for the 2024 Older Adult Roundtable Series on the Master Plan of Aging. This morning's program will provide information about New York's master plan, what other states are doing to plan to address the needs of their growing older adult populations. And as always, we have closed captioning for today's event. As a viewer, you have to activate closed captioning to view the text on your device. If you're in Zoom, click on live transcript in meeting controls to start viewing closed captioning. If you're on Facebook Live, you will see a settings button in the bottom right-hand corner of the video that says CC for closed captioning. Click it for the captions to start popping up on you. The forum is being recorded, and everyone who RSVP'd will receive an email with a link to the event video and the resources that are posted in the chat within a few days, along with the presenters' PowerPoints. So don't feel like you have to scribble everything you think is relevant down on a piece of paper, because you're going to be getting all of this information in easily reviewable form later. So now we're going to move to our event. Again, this morning's roundtable is about the New York Master Plan on Aging. New York State's older adult population is growing rapidly. By 2030, which is around the corner, 1 of 4 New York residents will be 60 years old or older. In 2022, the governor established New York's Master Plan for Aging process and charged the New York State Department for Health and New York State Office for the Aging to develop a comprehensive roadmap to meet the needs of all New Yorkers as they age. Today, our presenters will provide an overview of the MPA and the planning process. You will hear about what other states are doing to address the needs of older residents, as well as hearing from other leading MPA stakeholders in New York about some of the challenges and opportunities the plan presents. We have lots to talk about, so let's get started with introductions. Our first speakers are Joanne Warren, the Executive Deputy Director of the New York State Department of Health, and Andrew Liebwald, the Director of the Center for the Master Plan for Aging in the Office of Aging and Long-Term Care at the New York State Department of Health, and John Cochran, Chief of Staff, New York State Office for the Aging. Following Joanne, Andy, and John, we'll hear from Megan Burke and Aaron Westfall, program officers from the SCAN Foundation, which focuses on older adult issues. They will share information about state MPA plans around the country. And Dr. Laura Trejo, the director of the LA County Department for Aging and Disabilities. Dr. Trejo will speak about her experiences implementing MPA on the county level. And let's face it, as New York City residents, we never think anyone's as big or challenging as we are, but I think LA County might actually have us a bit beat on the challenges and the size of that community. Finally, we'll hear from Beth Finkel, the Executive Director of AARP New York State, and Allison Nickerson, Executive Director of Live On New York. Both are incredibly well-respected older adult advocacy and service organizations. Both are key MPA stakeholders who will share their perspectives on New York's MPA planning process and challenges and opportunities the plan presents. After the presentations, I will moderate a Q&A portion of today's events. Many people have submitted questions already, and we will try to get through as many of them as possible, but you will also have opportunities to type in questions in the Q&A option within whichever system you're in. So now it's my pleasure to introduce Joanne Warren and Andy Liebwald from the New York State Department of Health and New York Office. Oh no, they're both from the New York State Department of Health. Joanne and Andy.
Thank you so much, Senator Krueger.
Thank you.
Sorry, hang on a second. I will share my screen. And can everyone see the presentation?
Yes.
Okay. All right. Thank you all so much for this opportunity. And also presenting with us is John Cochran from State Office for Aging. Fantastic partnership between DOH and NYSOFA in the course of leading this initiative. And so as we jump in, we'll be giving opening remarks, talking about what the MPA is, talking about its structure and the subcommittees we've established, some of the priorities that we have as we develop the MPA, a look at the timeline as we move forward with it, and then we'll give an update on where we're at in the process, and then we'll hand it off to the rest of this event. So John, if you're with us and you want to make a couple of remarks also as we jump in.
Absolutely. Andy, thank you again for the time and the effort that you've put in on behalf of the Department of Health and working with Joanne. It's and the whole team over there. It's been a fantastic experience for us as we plod along and engage in what is a very, very substantive process. And Senator Krueger, I greatly appreciate the time and attention that you give to your constituents to provide them with information that I know many people find helpful. I know Greg Olson, Director of the State Office for Aging, sends his regards and wishes to have been able to participate today. You know, I know he's joined in one or two of these in the past and has found them to be incredibly helpful. And the people that I know that he's gotten feedback from on this event has been pretty spectacular. So kudos to you, Senator, for that great work and providing a really important service to your constituents. And so for me, as part of this process, I just wanted to put out there, and again, you know, as we were talking a little bit before during the our pre-introductions here, before we got on camera, about the nature of this process and the nature of this conversation, which is so broad and encompassing that I don't think we truly had a full realization of what does it take to help someone age successfully in the state of New York. We know it goes way beyond the boundaries of traditional systems that we think are in place and are the end all be all when it comes to assisting older people. But we know that it takes much more than just the traditional long-term care system, that we need to recognize the implications of what the built environment does. How can we change the built environment to help older people age successfully and help people of all ages successfully age in the state? So again, thank you for having me and allowing me to participate today. And I'll turn it back over to Andy.
Thanks so much, John.
Thank you.
So let's talk about why we're doing the master plan for aging. I think Senator Krueger referenced this, but by 2030, 1 in 4 of the people in New York State are going to be 60 years or over, of age or over. And so it's a major demographic shift, and we do need to be ready. And as we look at the systems and services that we have in place for older adults and for people with disabilities, what we see is a set of services and supports that were really put together piecemeal over the course of 50, 60 years and don't necessarily work perfectly together. They don't necessarily interface cleanly with each other. There's overlap, there are inefficiencies. And so there are already fantastic jobs that we're doing in terms of delivering services and supports, but we need to be ready to do a better job as we look at this demographic shift that's approaching. That both has to do with making sure that we're making the most of technology and of available resources in order to deliver better services and supports. It also means looking at making the most of our workforce as that demographic shift occurs and as there are fewer people to deliver services to more people. So we're looking at a need on a fiscal level. We're looking at a need on a resource level, including workforce. We're also looking at a need on a basic humanitarian level of making sure that we're doing a good job of providing what people need when they need it. So there are 4.6 million New York residents over 60 years of age already who not only are, and this is one thing we stress, a lot of the time this conversation can be a conversation specifically about resource allocation and providing services, but it's also important to remember the role that older adults play in the vibrancy of our state, economically, socially, and culturally. Older adults are one of the greatest sources of volunteerism in the state and entrepreneurship. And I know that John will talk a little bit more about that in a bit, especially when we talk about caregiving. But in recognition of all of these things, on November 4th, 2022, Governor Hochul signed Executive Order 23, establishing a process for drafting a New York State Master Plan for Aging. And it's important to note that the master plan is not going to be a document that drops in 2025 and then sits frozen in time forever. It's really a dynamic process that we're developing so that over the course of the next decade, we'll be able to continue to update it and be able to have a long-term plan for aging and long-term care policy that's constantly responsive to the changing situation on the ground, demographically and economically and technologically. And so we're working together now with stakeholders like Allison and Beth to create a blueprint of strategies for state government, and that'll include partnering with not-for-profit organizations and the private sector to develop a long-term plan for aging and long-term care policy. And fundamentally, the idea is that older adults should be able to live fulfilling lives in good health with freedom, dignity, and the independence to age in place for as long as possible. So it's a big agenda because people don't live their lives in neat little silos, right? It's not like people live their lives in little packages that are organized according to the agencies of New York State. And that's why we have several structures that we've built up, including the MPA Council, which is a council of 19 state agencies working to look at all of the ways that our state interacts with older adults. And that means that it's a bold agenda that we have to meet. We are looking at social determinants of health, which we take really seriously. So that includes transportation and housing. We are looking at healthcare and the way that healthcare utilization happens and delivery happens and what it means in terms of resource allocations, which implicates Medicaid and Medicare funding. As I mentioned, we're also looking at the workforce and what we're going to need to do to make sure that we have a workforce that's prepared for these demographic shifts and for current service delivery. But fundamentally, it is about all of the things that lead into making sure that people have the opportunity to age in the setting of their choice that meets their needs. And finally, fundamentally, and John's going to talk about this a little bit more, we have to look at the entire ecosystem that goes into how we support older adults and people with disabilities. And that means that looking at the caregivers and largely the unpaid caregivers in their lives, we're providing so much of the help that people need. The state can't do it all, and we need to recognize all of the pieces of the ecosystem that are filling in where we aren't. So, it's worth noting now that obviously New York State is not the first state to do a master plan for aging, and we'll hear from California soon. But New York State was the first state to explicitly take a public health focus with its master plan for aging. And we're doing that because, again, we recognize that people don't live their lives in neat little silos, and we can't really look at the way that we're delivering health care to older adults without looking at all of the other pieces of the puzzle, without looking at the social determinants of health. And so that connects very neatly to what we also have in New York State, which is the prevention agenda, which looks at the ways that our public health policies can really impact how people are setting themselves up for long-term health and for aging successfully. And so the prevention works in 5-year cycles where they identify priorities for the public health agenda to push to really help people make choices that align with prevention concepts and that help them set themselves up for long-term health and not just expanding their lifespan, but their health span, period of their lives in which they're able to engage with their families and their careers and their communities and really enjoy all of their lives. So right now, the prevention agenda is finishing up its current 5-year cycle. And of the priorities in that 5-year cycle, clearly the master plan aligns with the idea that we need to prevent chronic disease and we need to promote a healthy and safe environment. We want to promote well-being and prevent mental health and substance use disorders. And we also want to prevent communicable diseases. And we're working with the prevention agenda currently in coordination as they develop their next 5-year plan. I'm going to invite John now to give some comments on family caregivers and their importance and how we're working with them in the course of the MPA. So, John.
Yeah, thank you, Andy. And before I take us through a bit of a deep dive on the caregiving issue, I wanted to highlight for everybody who's on the call that the nature of the work that Andy just described is being driven, at the highest levels of state government. And Joanne Moore's participation in today's conversation, I think, is a reflection of that commitment. And as we continue to try to wrangle all the different places, I mean, you got to understand the Department of Health is a huge organization. There are so many other state agencies that are involved in these conversations, and having one of the key leaders of the Department of Health involved in this process will help us advance within the Department of Health as well as other state agencies, a gathering of the brethren who are engaged in policy making, whether it be around public health, whether it be around the prevention agenda, whether it be about licensing and operation of long-term care facilities, or how do we better support caregivers through traditional infrastructure that exists through the home care industry. Joanne's bringing to bear a place in the Department of Health, a location, a specific spot that can help drive everyone coming together to help provide us with the guidance that's needed to make sure that all parties are involved, and then reaching out to other state agencies as well. And so what I wanted to touch on,
Let's
and
just give
Andy,
it to Joanne just because we're running late, John.
yes,
Thank you.
I apologize about that.
Okay.
So basically what I wanted to just touch on is just the notion of caregiving. Caregivers in the state of New York, there are over 4.1 million caregivers in the state who are providing over 2.6 billion hours of unpaid care. That if you were to take a look at the market rate would be over $39 billion annually. And the importance to recognizing that is that as we are engaging in a conversation about how do we improve the quality of life of older people in the state of New York and helping people age successfully, we need to understand that there is this huge underpinning of what is actually the place where most of the work in the long-term care universe or the policy space is happening. And that's by unpaid people, family members, and others in the community who are stepping up to assist others. In the US today, 1 in 6 people are a caregiver for a relative or a friend, and they're spending 20 hours a week of providing some type of care. And that basically it's important to understand the ramifications on the economy of caregiving, because what we know is that caregivers are under a tremendous amount of stress. We know that the difficulties and challenges that they're facing are unbelievable. It was referenced in a Wall Street Journal article last week. The State Office for Aging is engaged in other efforts to make sure that we're highlighting the role of caregivers in the economy and making sure that they can continue to participate, because we know ultimately that the caregivers, the informal caregivers, are the ones that are holding together our systems through their support and through their dedication.
John, again, I'm going to cut you off now so that we can go on, please. Thank you.
Thank you, Senator. I appreciate it.
Thank you, Joanne.
Thank you. So just quickly, building on the conversation that's already taking place, you know, we see New York as the first age-friendly state in the nation. And what you see here are a list of some of the key areas in which we feel we have prioritized making sure that there is actual access and ability to safely engage, whether we're talking about outdoor spaces, transportation, social participation. We know that most recently the conversation around loneliness and isolation has really been looked at from a scientific and from a social research perspective, and trying to understand what we can do to assist individuals from some of those experiences. But most importantly, what we're talking about as an age-friendly state is looking at those opportunities of building equity for individuals and recognizing that all of us are at a certain stage as it relates to aging, but particularly for older New Yorkers, we have to ensure access to and safe access to any of these areas, as noted here, in order for there to be equitable and satisfying life experiences. Next slide. So what you see here is a timeline as far as all of the significant steps that have been taken in the implementation of the Master Plan for Aging. One of the things that I certainly want to highlight is that there is not a single step here that has been taken without the engagement of stakeholders and community members, as well as persons with lived experience. Most significantly, we continue to find spaces so that we can add voices and look at the diversity of all who are contributing to the process. Without going through each of the steps, what you see is some of the key areas from November of 2022, when the governor signed the executive order, to an anticipated future date for a release of the actual blueprint or the Master Plan for Aging. Next slide. And in this last year, just to offer some brief highlights as to what we'll be focused on and what has been accomplished, creating 8 subcommittees and 34 work groups, again, adding to the voices that are at the table for input and representing individuals who are at the priority of this plan. The holding of 22 town hall meetings across New York State to ensure voice from diverse areas, recognizing that New York State has a very rich diversity within it. Issuing a public survey in which we received an overwhelming 10,000 responses and over 650 meetings in which, again, input and guidance were able to be demonstrated and documented. Next slide. So the Master Plan for Aging proposal does have a review process and certainly aims to address any of the longstanding challenges that have been identified when serving older adults or individuals with disabilities. Here you have a list of some of the key actions that have been taken, proposals developed by individuals who participated as members of the work groups and subcommittees, as well as input from other state agency partners, understanding that no one sector, be it government or community, can certainly respond in a meaningful way independently. Proposals that reflect public comment through the Master Plan for Aging town halls and the listening sessions, looking at the financial impacts and also looking at and assessing how the work with existing programs or current efforts can be expanded or enhanced. We continue to look at any of the recommendations as far as alignment related to existing legislation, but also most importantly, looking for the opportunity to build on what exists. Certainly the conversation of ensuring access of services, care, and determinants of health for individuals who are aging is not a new conversation. This is a building of a foundation, and this is about creating a framework where there can be consistency in how we respond across our state. Next slide. And so how can you help to continue to develop a master plan? And how can you gain knowledge as far as understanding what has been done and what opportunities there are to as we move forward? Communities and individuals still have an opportunity to share input. You have access to the town hall and listening session meetings, visiting the Master Plan for Aging website, which is on the New York State Department of Health, and also lists any events or upcoming opportunities. Emails are more than welcome as far as input, recommendation, or comment. And you'll see in the chat that also has been placed there. So you can just copy and paste. And the website for the Master Plan for Aging is also noted. And with that, I'll turn it to Andrew.
Thank you very much. Oh, Andrew, you had something else? I'm sorry.
Just to say that we respond to every single email that comes into the MPA inbox, and we, the work group process may have ended, and we're consolidating things as we prepare an advisory report with the Stakeholder Advisory Committee. But there will be an implementation phase that we are planning. There will be constant updating, and we want people to stay involved and keep giving us your ideas and comments.
Great. Well, thank you very much. I'm now going to move us. Oh, we've been joined by Beth Finkel, hi, from AARP. And what we usually do here, folks, if you're not the presenter right then, we ask you to just turn off your audio and your video. So I'll be jumping in and out myself. Our next speakers are Megan Burke, Erin Westfall, both program officers from the SCAN Foundation, and Dr. Lauren Trejo, the director of the LA County Aging and Disabilities Department. Thank you all for being with us this early in the morning for some of you. I guess Erin and Megan first.
Good morning. I'm sorry it took me a minute to turn my microphone back on. I'm thrilled to be here with you today. I'm Erin Westfall. I'm a program officer with the SCAN Foundation, and am going to spend a few minutes talking about some of the work that's happening that New York's a part of, the other states and nationally. And then I'm going to turn it over to Megan to talk about what California's done. And then, as you heard, Laura is going to spend some time talking about what local implementation has looked like in Los Angeles. The SCAN Foundation is a public charity. We're based in Long Beach, California. And we're about 16 years old. And our mission is really to improve the system of care for older adults. And we do this through providing grants that look at how to strengthen the aging and health infrastructure, thinking about financial stability as people age. How do we make aging more affordable and more accessible, and ensuring equitable aging for all? So the work for the multi-sector plans on aging has been really core to really since the foundation started. We thought, you know what, California really needs to have a comprehensive plan. And it's been amazing to see all of the movement that's happened really since 2018 in this space. So I wanted to start with actually the most recent, which is the National Framework on Aging. So Congress charged the Administration for Community Living to develop what is called the Interagency Coordinating Council or Committee to work with other federal departments to develop a comprehensive plan for aging. They're calling it a national framework, but it's just like New York's Master Plan for Aging or other states' multi-sector plans for aging. A report to Congress just went out last month, which I'll show you in a minute, the title page of that. And you can see that they've identified 4 key areas as part of this national framework. We heard from our first speakers about we have to plan. Everybody's aging. Any changes that you make today are going to help those who are going to be older adults in the future. And so at the national framework, they're looking at coordinated housing and supportive services, aligning healthcare and supportive services. This should sound a little bit familiar for what we just heard. It's in New York's plan, age-friendly communities, and increasing access to long-term services and supports. I provided a link to the report to Congress that the Interagency Coordinating Council or Committee just put in May, and you can take a look at it. And the other thing is that you can also comment and give feedback. I provided a link as well that allows folks to go onto a website. You can identify if you're an individual or you're representing an organization, and let the federal government know, do these priority areas resonate with you? Where do you think more needs to be done? In addition to that open website where people can provide feedback, there are also a series of listening sessions that are happening across the country that are bringing older adults together to hear more about the framework and to provide feedback and their opinions. So that's what's happening at a national level. And then when we think about other states, it's pretty amazing. In the last 3 years, we've gone from like 3 or 4 states really thinking about and engaging around a multi-sector plan for aging. And I'm sorry, it's really like the last 5 years. COVID really made my identifying timelines off. So about the last 5 years to where we are today, where we have 26 states that are engaging in a in either the development, doing a lot of community engagement, bringing stakeholders together, to having legislation or an executive order to build a plan, to implementing their multi-sector plans on aging. And every state does it a little bit differently. Every state also calls it something a little bit different. And that's okay. But what we know is that there is this larger movement that is happening from local levels to statewide to nationally, to think more comprehensively and in a more coordinated way to meet the needs of an aging population. We're doing work on this with other states, with the Center for Healthcare Strategies. I know that your colleagues in New York who were just presenting have a touch to the Center for Healthcare Strategies, who has an enormous amount of tools and resources and continue to work with other states in this space. And at this point, I'm going to turn it over to Megan to talk about what's happening in California.
Thank you, Erin. If you can go to the next slide, that'd be great. So California, as Erin was saying, I think we've been having a dialogue about planning for a while, and I think kind of kicked up the momentum in 28, and then 2019, Governor Newsom issued the executive order for California's master plan. And after over a year of pretty intense stakeholder engagement, California's master plan was introduced in 2021, and we are in year 4 of implementation. California's master plan has 5 pretty bold and broad goals. One focusing on housing, another focused on health and care in home and community. A third that focuses on, we're calling it inclusion, equity, not isolation, kind of broad examples of initiatives under that goal are addressing the digital divide, coming up with solutions around the older adult workforce, and many others. There's a goal focused on caregiving, both paid and unpaid, and then a goal on affording aging or economic security, with lots of initiatives under all those broad goals. I think, as Andrew had mentioned earlier, with regard to New York's master plan for aging, California's master plan for aging is also a living document to be reviewed and not to sit on a shelf. And to ensure that, we established a process that every 2 years the state is to review the master plan for aging and update the initiatives. So that first round of review and update started the end of 2022. That created a new set of initiatives for 23 and 24, and we're stepping into the second round of review at the end of this year for the next 2 years, for 25 and 26. I think through that process, again, some pretty significant stakeholder engagement. Stakeholders were able to really give the feedback to the state of, well, that all these things are important in our master plan for aging. We really want to dive in, focus, and prioritize housing and homelessness, addressing home care, access to home care for all, and then addressing the behavioral health needs for older adults. And so taking that feedback, that's been a big focus for the last couple of years and has helped guide, I think, policy and budgeting support to be able to try to move some of our work forward. I think early on, as we were developing our master plan for aging, stakeholders really elevated the need to focus on equity throughout. And so how do we identify and address disparities in care and access, and the policies and solutions that are brought forward? How do we ensure that they're not furthering disparities or creating new disparities? And so through our stakeholder work group focused on equity, they created a tool for assessing solutions that are brought forward. And then we've also continued to evolve our thinking around how to address equity, in that hearing from folks, hearing, I think, people's stories and hearing about their lived experiences from representation across the diverse population really helps to, I think, shape the work we're doing and inform. And so California is now working to develop actually an advisory board of people with lived experience, so older adults, to kind of draw on their experiences, even more so to, I think, bring forth recommendations and help guide the work of California's master plan for aging. Erin, if you can move to the next slide. I think as we think about, there you go. As I think about how folks can get involved, even in New York, it's, again, going back to valuing your lived experience. And so being able to share your story when there's opportunity. I think it was Joanne, Andrew, and John talked about many of the different opportunities in New York for stakeholder input. And so taking advantage of the opportunities to learn more about what New York is doing around master plan, like we are doing today, and engaging, I think, and providing input where you're able. And then this third point I have is, advocating for a local plan. And one of the things that we've learned throughout our process is that to really realize impact, work needs to be done locally. And so one of the things that California did was create actually a local playbook. So, the master plan for aging is supposed to guide work at the state level, but it can also guide some of the work at the local level. And so, Erin, if you don't mind, moving here. So we created a local playbook, and the SCAN Foundation early on supported some work with developing local plans. And now the state has stepped in with grants for some local planning as well. So we have 3 counties in California that currently have a master plan for aging that is developed, again, with input from local providers, community members, and local government. There's 29 counties who are pursuing a local MPA. And like I said, our California Department of Aging has created a grant program to support up to 36 communities in their local planning. And so we invited Dr. Laura Trejo to come and share a little bit about the work that they've done in Los Angeles at the local level. So I'd like to turn it over to Dr. Trejo.
Thank you. I really appreciate it. And thank you, Senator, for inviting me. I really appreciate the opportunity to share work that we've been doing here in Los Angeles. Hopefully you can see my PowerPoint. Can I get a yes? You can see it?
Yes, would you
there-
mind just going into presenter mode?
Okie dokie, thank you. Here we go. There we go. So thank you and good morning. I'm going to share with you about 10 years of our journey that has gotten us here in building an age-friendly region for Los Angeles. These are just some of the key people, both in the city and county of Los Angeles, that have been part of our purposeful aging team over the last several years. As you heard earlier, New York is growing an aging population, the Los Angeles region as well. We have one of the largest concentrations in our state of older adults. About a quarter of older people live in our county. And our population of older people is actually only 10 states have more older adults than Los Angeles County right now. And we have 88 cities that we work with within a 4,000 square mile radius. Our school system speaks over 140 languages and dialects. So it's an extremely diverse population. And I wanted you to have a sense of the diversity. We're also, burgeoning a growing population, that it's extremely ethnically diverse. And we're also living longer. So that's the good news. More older people, but it's going to radically affect how we develop programs, services, and policies for the region. This is just to give you a sense of our demographics. We're currently about 20% of our population is over the age of 60 in Los Angeles County and growing. We have about 30% of them are living alone, which is a concern in terms of how do we respond and provide adequate care. We also have one of the largest concentrations of persons living with disabilities in our region, and a growing concern about homelessness also in this population. We're very ethnically diverse. We tend to be the home of some of the largest concentrations of every ethnic population, racial group, and persons outside of native homelands, with very few exceptions. So the richness of our diversity is something that we keep at the forefront of the work that we're trying to do. We also are unique. We have 2 area agencies on aging in Los Angeles County. I think we're different than everywhere else because we have to actually coordinate within our region in order for us to be able to really think through what are we going to do on behalf of older persons. This is just to give you a sense of our starting point. When we built our steering committee for Purposeful Aging Los Angeles, we brought together thought leaders from both academia, the private sector, and our county and city agencies. And of course, our partners, our AARP, that have been foundational in our success. This is just to give you a sense of our original members back in 2016 when we launched. As you can see, it's a very diverse group of people from a variety of settings because we wanted to actually have diverse points of views at the table when we were thinking this through. Our vision for Purposeful Aging was to make the Los Angeles region the most age-friendly in the world. That's really the standard that was set by our 22 elected officials, and is what we are trying to live up to. These are our domains of livability. You saw New York's. As you can see, they're very consistent. One of the ones that it's highly unique for Los Angeles is we put emergency preparedness and resilience because of the nature of our region. We also created what we called lenses. We wanted to look at every domain within 4 areas of appreciation. 1, how age-friendly was the work that we were trying to do? How did it need to be different or adapted? We wanted to ensure that whatever we were doing kept in mind accessibility to people that have different levels of ability. We also wanted to make sure that whatever we did took into consideration inclusiveness and diversity of our community. And we also wanted to make sure that we were focusing on the issues related to cognitive impairment and dementias. Our region now, we're experiencing the 3rd leading cause of death is among people with Alzheimer's, which tells you that we're an aging population. So we wanted to be very intentional in doing that work, to be also dementia friendly. This is just to give you a sense of our domains and how we've been working to them. We've been really trying to leverage existing resources. We were not trying to reinvent anything. We were trying to engage as many coalitions and groups that were out there in the work. We were also trying to figure out how do we assess what our community needs. One of the unique things that we learned from Oregon, and we encourage New York, look around the country and around the world and take best practices. We did. For example, one of the things that we did, we're the largest employers, the city and the county, and most of our employees live in our region. So we created a survey for all of our employees as well, to assess what they wanted in our region as they were aging. We were also working with national partners like the National Council on Aging and implemented the Age Mastery Program, which helps older adults kind of have a roadmap of well aging. We are also working and supporting cities. As I shared with you, we have 88 cities in becoming designated themselves. And so we're very excited about that. Our academic partners actually went on a tour in 2018 of European nations to look at firsthand what best practices they can bring back home. So we've really tried to be as inclusive and as comprehensive as we are able to. This is just to give you a sense of our engagement process. Lots of working groups. I heard New York shared about the number of working groups you had. I commend you. I know how hard it is to do that. We also have been doing that. We continue to evolve that. We just got our redesignation for another 5 years. So we're now, raising our game to another level as well. This is just to show you the city and county agencies that have been at our table from day one, helping us to implement this work. This would not be possible without the direct engagement of our partners in the government sector. To give you some idea of our outcomes, we had policy directives from the mayor, from the Board of Supervisors. We've adopted motions and our reports, our recommendations have become an integral operational mandate to city and county agencies. We actually have been working very hard across the sector, so much so that one of the members of our Board of Supervisors was a member of the Governor's Master Plan on Aging, which we're extremely proud of. And most recently, our county became the first in the nation to be designated an age-friendly employer. This is just to give you a sense, and you can go on our website and look at our action plan and our survey and all of that work. Our survey yielded about 14,000 responses. We conducted it in 9 different threshold languages, and we had literally hundreds of presentations and focus groups and all kinds of things that we did. But most important, we had 300 older adults help to select the priorities that you see in our action plan. After we got done with all of our work as professionals, we handed it over to the true experts, and we asked older people to prioritize our work. And those are the recommendations that you see in our report. We also have a lot of work at the community level that we've been doing. It's been 10 years. Stakeholder engagement has been critical. We actually held summits that reached over 3,000 older people in our region to provide us input about our direction. We've been working tirelessly, as you can imagine. This work actually became a foundation for our COVID response in our community, which we're very, very proud of. And we've also worked with our academic partners. 3 of our universities have now become age-friendly university designated and become part of the national network. So we again continue to be very proud of the strategies and the synergies that we've been able to leverage in our community. This is just to give you a sense. We weren't rebuilding the community. We were just trying to figure out how to coordinate better, how to access resources, how to engage with folks that have been working in isolation. And so we became a convener. Our activities really brought people to the table, and we're very proud of that work. This is just to show you that we were also focusing on what are we giving people while we're building this plane. We wanted to give them a service. So this is different ways that we were able to actually begin to deliver some benefits to our community through our Age Mastery program, through our LH Found program, which really addressed the unique needs of persons with Alzheimer's, dementia, and autism that wander. We actually did an assessment of 4,000 bus stops in the city of Los Angeles to prioritize which ones needed to be revamped so that they would be more accessible to older adults. And again, that would not have been possible without this work. We also were able to secure additional funding for new programs, which we're very proud of, that our coalition and our synergy of being in the room allowed these things to occur. This is just to give you a sense of a couple of the recommendations. One of the things, recommendation number 1 kept talking about, we need to better coordinate and respond. Well, one of the results was Los Angeles County launched a new county department that I'm now honored to be able to build and lead right now. We've also just recently received a grant to create a regional aging and disability resource collaborative. And for the first time in our county history, we're developing one unified strategic plan between our two area agencies on aging, which we're very proud of. As you can see, we've been doing a lot on brain health with our public health agency. Again, important work because we're mobilizing a community in a very different way, and I encourage you to look up this work. So you can see we're not boring people. We've also been working with our partners in the arts. We've been bringing and trying to understand how art can improve the well-being of older people in our communities. Actually had artists in residence at our senior centers, which has been very exciting to see that evolution in that work. We just had the Joffrey Ballet, thank you for coming to Los Angeles, to be in our senior centers and teaching our older adults about mobility and the importance of staying healthy. You know, in progress, we continue the work. We continue to really try to expand the opportunity of really trying to change the systems and the infrastructure that support the well-being of older adults. And so we have a lot of work ahead of us. We're very excited about the opportunities that are being presented, especially because of the Master Plan on Aging in California has opened a lot of doors for all of us. We also have received, you know, recognition for our work, which we're very proud of. And we continue to strive, you know, for excellence in everything that we do. One of the things that we pledged at the beginning was to make sure that we were adding to the field. That's why the partnership with academia has been so critical to us, because we have also been publishing a lot of the work that we do to try to make sure that we're sharing the lessons learned, and so that people can support aging of populations in their own communities. So I encourage you to also peruse some of these articles. We put a lot of our heart in them to make sure that we were sharing with our colleagues what was happening in our community. Thank you for the opportunity, and I look forward to your conversation later.
Thank you so much. Really appreciate all the information from LA County, particularly given New York City's parallels. All right, we're running late because we had so many interesting people. So now I'm going to turn it over to Beth Finkel, Executive Director of AARP, and Allison Nickerson, Executive Director, Live On New York, about the challenges and opportunities ahead. Remember, this is talking about the process here that we need to move forward with, as we have learned from our colleagues from SCAN and from California, who's a decade ahead of us. So Allison and Beth.
Well, thank you so much. Thank you for including me in this. I am also a constituent, so I live in the district, and having Senator Krueger as our senator is, I don't know that everyone realizes how much value she brings for her district, but for all of New York State. So I just want to thank her and thank her for including me in this. AARP has been at the groundwork of all of the work that people are looking at in the Master Plan on Aging. I think you heard everybody talk about this is all derived from age friendly. Matter of fact, there are 8 domains of age friendly, which I know you heard our Department of Health talk about, and now you just heard LA and California talk about. And I think we all need to just stop a second and think about what that means for our everyday lives, in New York State, but our everyday lives really on the, in Manhattan and on the Upper East Side. So we can talk about transportation, and I noticed there were some questions in the chat around bus stops and assessing bus stops, but it's also about assessing walkability. How safe do we all feel in the community? There's been a lot of redesign of streets in New York, and a lot of that is based on some of the best principles of age friendly, which isn't to say that there aren't still a lot of improvements that still can be made, and AARP is looking at walkability, but also access to mass transit. We talk about housing, we talk about affordable housing, and we talk about housing that works for you at every stage in your life. So you can hear that again in a lot of the plans that have been discussed. So what is your apartment? Is it, or your home? Is it fitted for you to age in place? If you're in a walk-up, that is difficult. That's challenging as you age, and that's something that New York really has to grapple with, especially the 5 boroughs of New York City. When we think about, do you have grab bars? Do you have doorways that can accommodate walkers and wheelchairs? I mean, these are all the things that we have to think about, because I don't know about you, but I love aging in New York. I don't intend to go anywhere else, but I need to make sure that where I'm living and what my community is like allows for that. So really happy to hear Andy talk about social determinants of health. We're experiencing that right now, right? Worrying about climate and the heat, and can we afford our utilities, and are our utilities built up to be able to support us in the heat that we're experiencing this week? And I think all of us who've been lifelong New Yorkers know that we've been on a continuum of weather challenges. And then when we stop and think about what are the other determinants of health, access to health care. What does that mean for us? What does that mean to have enough gerontologists in New York? What does that mean to have enough caregivers, both informally and professionally? I think it was Rosalind Carter who talked about, if you, one day you will be a caregiver or you will need caregiving. And we all fall into one of those categories one day. And so we need to make sure that New York State is focused on that. And I appreciated John Cochran talking about that also, because SOFA has really been doing an outstanding job of addressing how people can age in place. So I can go on and on about all of the different areas of age-friendly. We talked about housing, but also workforce. Many of us are going to be working much longer than we might have originally planned to work, or some people are going to have to return to the workforce, and we know that that is challenging. So another thing that you might have heard Andy mention, addressing the needs of older workers, and how do we make sure that we're living in a state that is ageism free. I know Allison's going to mention that also. I think that my time is going to be limited because we did run over time, but I just want to make sure that everyone knows that AARP New York is fighting for all of this all of the time, and we are engaging volunteers to help us in that fight. Just yesterday, we were down at City Hall, try to get the mayor and the city council to put more money into aging services. Aging services in New York City get less than 1% of the New York City budget. And there are 1.3 million people who are older adults in New York City, by the way, more people than are in the Bronx. And to have less than 1% of the budget dedicated to that is not truly age friendly, nor does it fit into the master plan for aging. So I would encourage all of you to join AARP, get in touch with us. It's aarp.org/NY. It's AARP New York, aarp.org/NY. And we'd love to hear from you. So I'll come back again if there are questions that you'd like me to answer. Liz, I hope it's okay. I abbreviated what I intended to present.
Thank you, Beth. Allison.
Sure, thank you. Thanks, Beth. I'll try to also keep it quick since I know we're out of time and I know we want to have a nice Q&A time. So I'm Allison Nickerson. I'm the Executive Director of Live On New York. We have a membership of 120 nonprofits. They run about 800 to 1,000 programs all over the city and state. And we do a lot of advocacy, policy work, workforce development, and direct service to help people thrive as they age. So challenges and opportunities. Let me go to challenges first. The biggest challenge of this process, this is a political process, right? This was an executive order by the governor to do this work. And so the challenge is making sure that there is enough political will at the governor's level to make sure that this stays on the table. We're living in a time where there's things like that pop up on my New York Times app like every 5 minutes. And so making sure that these issues stay top of mind is crucial, because we have then 3 additional challenges that fall under that. Number one, and I saw a comment on this from Nancy, funding is a crucial part of making sure that this work happens. There are 18,000 waitlisted services. People cannot get services in the state, like basic safety net services. That's a major, major problem. There has been no serious investment in the New York State Office for Aging since the 90s. We have a flat line, and if you take in inflation, it probably is a negative line. And so we need to make sure that staffing funds are available, that transportation funds are available, that we can fund food for people who need food. I think I saw in the chat, I'm going to call out Bobby Sackman, who often says that people just muddle along. And so if we do not have structures for people to make sure if we do not have funding to make sure the recommendations that come out of this are real, people are going to muddle. And so we need to make sure that the funding is there. So here's some opportunities really quickly. Here's what to look for. We want to make sure that this information is in the state of the state. Everybody, every constituent on this call can log in and see the governor's state of the state, which will occur in January. We want to make sure that aging is mentioned. There are so many, an increasing amount of people. Well, everybody's aging, right? Every single day, but there's so many more people over 60, over 65, over 70. We need to make sure that that is mentioned and talked about at that event, because that will signal that this is really a priority. Number two, we need to make sure that there are reports that you can see, right? The state, our colleagues at the state are putting in a huge amount of work. Many of you, I'm sure, have attended town halls and weighed in. We want to make sure that the government is responsive, is sending out those reports so we can all weigh in, and that there's a lot on the governor's plate, and there's a lot always happening up in Albany. So making sure that those recommendations are released and that we can react is really important. I love the idea, I forget who said it from California, that there are 2-year reviews. I love that idea because it keeps the momentum going, right? So looking at things like that to say, okay, there's a plan, there's some funding, hopefully, right? What happens in 2 years? What happens 2 years after that? So that this is not something that should be happening in 2023 to 2025. This is something that should continue on for decades. So making sure that there are accountability measures so that other administrations can continue to sustain this work is really important. So here's what I would ask you to do. You all are so very lucky because Senator Krueger is one of the amazing champions for aging in the state. We have such an amazing champion, Liz. I'm so thankful for your leadership. I hope you don't mind that I called you that, Senator Krueger. So, but I think there's other people who need to hear that these are major issues. We have 2 of the chairs of aging are in New York City, Senator Clear in Harlem, Assemblyman Ron Kim in Queens. They also are champions, but they also need to hear from people. You have several assembly people in your district who you can call and say, please make sure that you are advocating for the master plan for aging, because they too can raise their voice. It also makes sense to call your city council people. We want them to pressure their colleagues in the state, right? We want city council, or if you feel so inclined, the New York delegation. We have incredible federal people. Every single time that it's raised that older people, that all New Yorkers care that New York is a great place to age, no matter your ability, no matter your zip code, no matter your age, no matter your background, it starts to sink in. So make those calls, make those emails, and talk to your neighbors about what you need and bring those issues forward. So the more that we can have the drumbeat, the better off we'll all be. And we can support our state colleagues who are doing a ton of work to make sure this happens. So I look forward to seeing the recommendations released and be able to send those to all of you through Senator Krueger's office. I think that ends my time. Thank you.
Well, thank you, everyone. So much information, so little time for questions. I'm going to try to summarize a few and maybe even answer a few as we move on. But the first one is, how do all these great people listening today submit their ideas to the master plan? And is there a deadline?
It's a great question. As I mentioned, we respond to every email. We are compiling all of the comments that we get from the public. We spent the last year holding town hall events across the state. and we conducted the public survey that got more than 10,000 responses. And we had a 10-month work group process that involved more than 430 stakeholders from groups and communities across the state. So right now we are consolidating all of that. And over the summer, we're going to work with the Stakeholder Advisory Committee to release an advisory report. But then we'll be pivoting to planning implementation, and implementation is not ministerial. It's still a kind of, it's a discretionary is the wrong word, but it's a process that involves judgment and development. And so we will still need to hear everyone's priorities and needs. And then over the course of the next decade, as we continue to evolve and update the master plan, we'll still be taking in everyone's ideas. So for now, the best thing to do is to email us. And we do anticipate that once we release the advisory report, that we will restart the town hall process and keep appearing around the state and creating opportunities to keep hearing everyone's ideas.
So a lot of the questions, as expected, relate to the affordability issues in New York, both for housing as you get older and you have a fixed income, and also the costs and access to healthcare, including home care services, and even the concept of places where you can go if you really can't live on your own anymore. I guess I would like to address it to the California and scan people, because I feel like we know what's out there and there's not enough. And I'm wondering whether you have discovered other models we should be looking at. So for example, we have something called naturally occurring retirement communities in New York, but there's very few of them, even though they can be an amazing way for older adults and disabled adults to stay in their own homes, because there's services in the building, not necessarily individual one-on-one in your apartment all the time, but there's home care workers in the building, there's social worker in the building. Have SCAN or California come up with any kind of models like this that allow you to sort of cover maximum services for larger numbers of people instead of one at a time?
If you don't mind, I can go. This is Laura. We're actually looking at how reimbursement is changing, like Medicare, that is now supporting more community health workers. We're looking at Medicaid. In California, there's a tremendous shift in how our Medicaid programs are running. So we're being at those tables to sort of intentionally make sure that we're educating the constituents about the unique needs of an aging population. But we are looking at reimbursements. We're working with health plans in the private sector to encourage them also to understand how to collaborate better between health and social support programs so that we're providing optimal support to our clients. Those are just some of the areas that I would encourage everybody to be looking at.
And on the healthcare side of it, also, since you mentioned Medicaid, we have a very robust Medicaid program in New York State, I think, compared to most states. And yet you still find that Medicaid, doesn't cover the costs for doctor's visits. And our nursing home situation is at crisis level. Do you have a model? I've always been interested in where you don't need the medical level of a nursing home, but you really can't be at home on your own anymore. And we do not have enough home care workers. And as the population grows, that's only going to become a bigger problem for people who don't have their own money. So do you have any kind of like respite model or not quite nursing home care models that actually are working, either you or SCAN or anyone else on this conversation?
We have assisted living, which is enriched residential. We're also reevaluating what kinds of resources we send into independent living facilities for the elderly, like senior housing. We're trying to figure out how to support people to stay healthy longer. We are also looking at the model, which I'm very excited by, the Villages model. That's where we're creating intentional communities that support older adults thriving in their local neighborhoods. So there's a lot of emerging models in the field right now that are very exciting and I think hold a great deal of promise.
We've talked a lot about the issue of aging alone, loneliness, and isolation, and that it's actually a serious health issue. I've had other roundtables just around these issues. And I'm curious if anyone who's working on the master plan is exploring some new models on how we make sure people know about this issue, understand it's nothing to be hiding, alone in your home. And in fact, if we don't address this, our medical costs will continue to skyrocket because loneliness has a direct correlation to medical illness as people age if they aren't addressing the underlying issue.
Senator, can I jump in on this one?
Please.
The folks who, there's been several work groups that have dedicated a lot of time to processing the social isolation issue and some of the best practices that are starting to come to the top of the policy framework to assist people. And there's also a tremendous amount of time and energy looking at innovations that are being utilized to help address social isolation through the use of technology. But in the end, it's all about people interacting with others. And so when we talk about direct service, we're also kind of trying to frame the dialogue around social isolation, also around changes to the built environment by encouraging the development of green spaces where people can gather, the development of housing infrastructure that encourages social engagement. So it's everything from the service piece, like we're talking about the NORC program, to the resident advisor program, to basically looking at ways we can entice people to engage in conversation just based on the way environments are created. And the village to village movement is something that Greg Olson has been a huge supporter of here in New York. And there are several places around the state where we're trying to get it to take hold. Thank you.
Can I jump in for just a second on that? I think two things. The first is that, as John said, one of the work groups took the Surgeon General's report on social isolation, which just had just come out, so maybe 6 months ago, and looked at adapting some of those recommendations for New York. So those should be included in the recommendations. The second is related to housing. There are several, and I think the housing work group did touch on this. There are several models. India Home has a model of like joint respite and supportive housing in Queens. The challenge is in zoning. So that's one of the things that we'd have to look at the zoning codes and look at how we fund the resident advisor and support services so that people don't have to rely on like the building super to help them do like health and wellness tasks, which I get a lot of information on, and it's just totally that's solvable. So I think those should be coming out in the recommendations as well.
Great. I don't think that any of us are the right people, but I'm gonna put it in my hat for another discussion. We've just agreed between the state legislature and city government to be doing conversion of older office buildings that are not going to be used as office anymore into residential buildings. And a lot of them are right here in Manhattan. And there's deals being made about government money being used to support the transition. I think we really need to build into that discussion X percentage of units being available for older New Yorkers who need new places to live that they can afford. Because people now are trapped in apartments that are probably too big for them at this point in their lives, but they don't have anywhere else to go because there's nothing affordable. But perhaps we can talk about, and maybe ARP and a Leading Edge will want to work with me to convince a couple of these buildings they should be doing specific projects, something like NORCs within buildings, to have available housing for older New Yorkers. Because I think, starting off with buildings that are empty to start with and have government funding is a very ripe opportunity we shouldn't let, disappear on us without thinking it through. So that's more a suggestion for us all to work on, and State Department of Health and Aging are more than welcome to participate in moving this discussion down the road. I just think there's real opportunity there. Lots and lots of questions about street safety, bikes, electric bikes, mopeds on the sidewalks, going the wrong way, not stopping at lights. These issues hit my office every day, every elected official in New York City every day. I don't think we necessarily have the right people on this conversation, but Wendy, we're going to slide somebody into one of our conversations soon on safe streets, which the city does have a model for, and Department of Transportation and some advocates on transportation to talk about the problems we all know are out there, but potentially some of the solutions, because this is a very, very real issue for old New Yorkers, people with disabilities, and
Yeah.
frankly, all of us at this point. So I'm not going to put anybody, sort of on to be the answerer of it, but I do think there are other people we could have in another virtual town hall specifically to talk about these issues. I don't think we've done that for a while.
It's
Yes.
Oh, sorry,
Senator,
John.
yeah, I was going to point to you, Beth.
Oh,
Actually,
good. I was just gonna talk about that. Thanks, John. So AARP, I think it just went in the chat, has a walkability survey that is made for everyday people to walk out and see if their intersections are safe. And just a quick heads up, and I know I mentioned it to the senator and her staff, but AARP will be doing walkability surveys across New York State in November, and love to talk to you more about that. So we can do some right on the Upper East Side, and I'll come by for those.
Perfect. I will definitely want to participate with you. Thank you. And sort of also all ties into sort of access to public spaces when you talk about walkability. So affordability. I mean, housing is never going to get cheaper in New York City. Let's be real. We try to control it going up as much as it does. There were a couple of questions around the SCREE program. That's a New York State and mostly New York City specific program that the rest of the country might be interested in. It's where if you're living in certain kinds of housing and you're seniors and your rent gets above a certain percentage of your income, you get to apply for a program called SCREE, Senior Citizen Real Estate Income Tax. Oh, I forget. SCREE and DREE for disabled people. And basically the city is picking up your property tax, picking up your rent increase instead of you getting a rent increase, because they give the landlord an equivalent tax, property tax deduction. Yes, it costs government something, but I believe in New York, it's been the most effective program there is for keeping senior citizens in their homes as their rents go up every year here, and I know they do everywhere else also, and their income is not going to. So having the government pick up the differential rather than their rent going up has just been a huge, huge win for people who are older and who have disabilities. And I was asked on the questions, are we going to expand that? The legislature is willing to do that as long as the city of New York says we'll implement. It's the city of New York's property tax that they are quote unquote giving up when SCREE expands to cover more people, but it's been such a hugely cost efficient and successful program. And it's not even, landlords don't mind it because they know they're going to get a reduction in their property tax equivalent to what they're not getting in a tax increase, in a rent increase. So it's sort of a win-win-win program that probably should be a model for other parts of the country, SCAN and your work. And I would love to see it increase. So we need to work on the mayor and the city council to call for an increase in SCREE value, eligibility, SCREE and DREE. And I'm always willing to work on that at the state level. So I think that's
Senator,
yes.
Senator, just jump in. I mean, one of the interesting things with SCREE and DREE, because it is so administratively, it works so well administratively. But one of the challenges that I know when I was reading a report out of City Council saying the utilization of DREE and SCREE, that there's a large number of people who are eligible for the benefit but that are not receiving it. I know Allison's organization and I know AARP often talk about the benefit and the availability of SCREE and DREE benefits. And so, working together to help increase enrollment of that, I think would be a great low-hanging fruit as part of the MPA, as to figure out how we can do that together.
Absolutely. And I guess one of the questions that came in was, should we have some kind of standardized phone number? And we have a bunch of them now in the state and city, 311, for non-emergency government information, 211 around the state. Should we have one for seniors that you call that number and they pretty much have all the information for every program that might be useful to you as an older New Yorker? Has anybody been talking about that in the plan proposal?
Yeah.
So the most common recommendation that we got from the work group process was some form of no wrong door, single source portal for benefits programs. I think probably half of the work groups generated a recommendation in that vein. So it's something that we're already looking at and what would be involved in implementing. Obviously, there's a very broad landscape of programs across state government to rope into that and to make available. But it's clearly a high priority for this process.
Great, great. I might have said the wrong name for Allison's group. Live On New York is what I meant if I accidentally said something else. Sorry. So on affordability, all kinds of questions relating to all the costs go up. I have limited, retirement savings and Social Security. I don't have an answer right now, but I want to let everyone know that on August 6th, we are going to have a roundtable specifically on financial planning and investing, and thinking it through for older adults, including issues around retirement accounts, Roth IRAs, 401k, individual stocks, etc. And things to think about as you are getting older, to try to best plan for the later and later years that statistically we're all living. And frankly, we're probably never really thinking through the number of years of retirement we would have. And that's one of the major reality changes because of advances in modern medicine that we have to factor in, that being an older New Yorker can clearly be, a third of your lifespan, and you need to think it through. And also employment. We constantly get asked about finding employment and staying on in jobs from 65 up. And the truth is there are plenty of people 65 and up who are working, and many more I find who want to be working and need to be working. So is the master plan, folks, discussing it all, how we deal with age discrimination in the workforce and how we come up with models to encourage employers to recognize the true value, in my experience, of hiring older New Yorkers who already have amazing job experience, all kinds of work skills, are very committed to jobs when they have them. Is the master plan address that at all?
Yeah. Hey, Andy, let me jump in on this. Senator, I know that you have asked at budget hearings over the years, you've asked Greg this question with the Department of Labor, this specific question. And I think your interest and the interest of your other colleagues had driven a conversation with our colleagues at the Department of Labor, where they're now looking to engage in setting up a Center for Aging and Workforce Development, basically focusing in on how do we facilitate within the larger Department of Labor one-stop system ways of engaging older workers successfully. The other big piece, the conversation has been also around getting employers to understand the role of informal caregivers and understanding the stress that they're under and the challenges that people are facing. Average age of a caregiver in the state of New York is 62. And for people that are older, that are remaining in the workforce, the challenges that they're facing being members of the sandwich generation, taking care of sometimes their kids as well as parents, that there's some very unique circumstances that they need to be aware of. And so we're really kind of taking a very close look at that. And then on the financial literacy standpoint, and working with, we had a whole work group dedicated to specific towards the, trying to calculate out and develop policy around that, the issue that you raised about the importance of folks understanding the realities of financial independence as they age and remaining financially independent as part of their life cycle.
Yes.
So it's been very interesting. And I know AARP has spent a lot of time working with us, talking about the economics of aging and talking about the amazing financial contributions older people make to the state's economy.
And Scan just put up on chat that they have been working on this issue and recently released a resource, and that will be forwarded to everyone who's watching today. Well, I have so many more questions, but we've actually run out of time. So I'm going to thank you so much for participating. Joanne, Andrew, John, Megan, Aaron, Laura, Beth, and Allison. Clearly, we could have spent another hour going through the questions, and unfortunately, we just can't. I want to remind everybody that my next virtual town hall will be on good cause eviction, the new law that gives protections to market rate renters, and that will be this Thursday, June 20th, from 6:30 to 8 p.m. If you would like to RSVP and have not done so yet, just email Wendy on my staff. Her email is wbrennan, it'll be in chat right now, at nysenate.gov, or call my office for that. And also our next older adult roundtable will take place on Tuesday, July 9th, here at 10 a.m. and we'll focus on transitions from hospitals back to home. And so many of us have had to deal with that for ourselves, our aging parents, our spouses. So that's, I think, another really important discussion to have. Again, thank you all for attending. Thank you all my guests for participating. And we'll see you all at the next event. Thank you.